Quiet over here.
I know, right? Oh, look at that. We're officially live. Welcome, everybody, to the latest edition of Tech Docs Lunch Chat. My name is Dr. Brad Brown. I am the medical director of Hint Health and a direct primary care doc myself, sitting in my clinic here in the Denver area. And we have with us today Dr. Michael Docktor of Doc Health. So, welcome.
Thanks for having me. Yeah. A lot of docs right there.
I know, right? I'm trying not to make a doctor joke.
Thank you.
I'm sure you've heard that a few times.
A couple times today. Yeah. Thank you for sparing.
Hadn't thought about it for 5 minutes. So anyway, and welcome to everyone who is joining us. We want to keep this as interactive as possible, so feel free to comment on anything that you hear. If you have any questions, we love having the back and forth and discussing. So we're going to be discussing Dr. Mike, I'll say that instead of Dr. Doctor. How about that? Dr. Mike's fantastic company and product, Doc Health, and how it is changing the game in terms of many, many things. So you want to give a quick intro to you before we dive into it?
Sure. Yeah, keep me honest. I don't want to bore the audience here, but yeah, I am in fact Dr. Doctor. I'm a pediatric gastroenterologist by trade. Been at Boston Children's Hospital for 15 years or so, and along the way realized that we didn't have the right tools to take good care of patients. And so about 4 or 5 years ago, I was playing with lots of, great tools for other industries and realized like we need a task management workflow automation tool for healthcare. And so we spun out Doc Health out of Boston Children's back in 2020, about 2 weeks before the pandemic, which was special timing. Yeah. Great time to build a company, as it turns out. And I've been learning a lot ever since, and look forward to sharing more with your audience about what we do. But fundamentally, it's giving care teams better tools to work better together, to take care of themselves. Put your oxygen mask on first type mentality, and giving them the tools to take better care of their patients and provide sort of VIP level care for everyone with better tools.
Nice. I like that analogy. Put your mask on first. It's similar to I've enjoyed peripherally following you and Doc Health over the last couple of years. To me and our story, my wife and my brother-in-law had the same idea. We started Aero DPC, then Hint Health acquired us for the the EMR side of things. So you see something, I love the mindset of, hey, you see something, let's make it better.
Yeah,
I support you.
Selfishly, it's great to have clinicians who know the pain to be leading the charge, and usually you're not alone. Like fundamentally, this wasn't a pediatric GI problem. This is a problem for everyone in healthcare.
Nice. Cool. So I want to ask, and I want to know for myself, obviously I've heard a little bit, but for everyone watching right now, can you give us the why behind Doc Health? You touched on it a little bit. You wanted to give the people the tools to streamline everything, but why? Like what gets you going in the morning to keep this thing going?
Yeah, I mean, I was, practicing at arguably one of the best children's hospitals in the country, taking care mostly of children with Crohn's and colitis. These are generally, kids, young adults who have, longitudinal problems. They're going to have this disease for life. And so, managing their care and all the sort of to-dos, for lack of a better word, that came from a clinical event. There's so much that happens in between a clinical visit, and I found myself and my team ill-equipped to really manage that stuff and make sure that we were doing our best for the patient. And, I have this desire, as I'm sure many clinicians do, to take the best care of their patients and provide that sort of, again, VIP level care. And I just didn't feel like we had the right tools to track it all. I was overwhelmed and frankly burnt out from just, trying to track it all. And despite my best efforts, not really doing as good of a job as I thought my patients deserved. And so it was a real sort of frustration. And I think that, we hear about burnout all day, every day. It's not just the physicians, right? It's the administrative staff, and it's the care team, broadly speaking, because we're not given the right tools. I was, despite being like a very tech enabled type of clinician, I was using paper checklists and Excel files and Post-it notes like everyone else. And just knowing enough about, I spent a lot of time in the innovation and informatics world. And realize, like, there are other industries that have figured this out. Why do we have to always reinvent the wheel in healthcare?
You
Uh,
mean change is slow in medicine?
yeah,
What? What?
yes. I mean, as you know, and I'll reinforce for your audience, it takes an average of 10 plus years to move from a gold standard, world class study into clinical practice. And so that's probably even longer in the context of, technology switching. So there's certainly some education that needs to be done.
Yeah.
This sort of like operational task management mindset is not something that has ever been taught or seen in a healthcare context. But at the end of the day, my belief is that everything in healthcare is a task, and we need to move from the sort of inbox mentality of how we practice medicine, so that
Yeah.
everything is like, we're coordinating care for complex patients through email and reply alls, and on Excel files. Like, we need more accountability, we need more visibility. That sort of frustration, that sort of anxiety that I would go home with every Friday, like, there's no doubt I forgot something and I'm going to figure it out on Monday when that angry patient,
Yeah.
says, I forgot to refill your script, or they leave you a bad review, that sort of stuff. Like, that was just like kind of unbelievable that we still practice that way. So
Yeah.
that was a long-winded why. So be careful what you ask
No,
me.
that's what I wanted. I love it. We all have that pit in our stomach where, all the physicians, we wake up at 2 in the morning and we're like, oh crap, I forgot to do that, or, oh, did I do that? You know,
Yeah.
and
Yeah.
that is very real. And it only gets worse with the moral injury and the burnout, because then you're second guessing pretty much everything that you did. It's like, I know I already did that, but I have to go check that the front door is locked, even though I know I already locked the front door.
Yeah, totally. And it's also, sorry to
Oh, go
push
ahead.
on this a little bit further, but it's also like making it easier for you to delegate tasks with your team, so that it doesn't all fall on Dr. Brad's lap. That,
Sure.
it's not, we, as, taking that oath, we take it upon ourselves to make sure that all that stuff's done. But part of, playing a team sport is that it's easy to delegate to people that are better at things than you are, and maybe are hired to do just that thing. So you just need visibility into it.
Yeah.
That's sort of what we're trying to provide.
This is one of my flaws. I have a really hard time delegating because I'm a minor control freak a little bit. But
Yeah, well, so
maybe,
as am I, but I would argue that if you had visibility into what that team member was doing,
yeah,
um, you wouldn't worry about it as much.
that's
You
true.
could delegate it because you've got a little bit of control in seeing where it is and who's responsible for it, and
Yeah.
when that loop gets closed.
I mean, we're 8 minutes in. I'm already sold. So
Okay, maybe we should quit while we're ahead.
I know, right? Thanks for coming today. No, so obviously the point of this Tech Docs chat is almost not to announce, but to talk a little bit about the integration between Hint Health and Doc Health, right? So more of a 30,000 foot view. How does Doc Health integrate with fill in the blank? Because you have a lot of integrations. They're all listed on your website, which are some big names and some really cool ones. But in terms of high level view, how does it integrate with, how does the system integrate with fill in the blank? And then we'll get into Hint here in a minute.
Yeah, I mean, at the end of the day, Doc is trying to capture all the to-dos that are
Mm-hmm.
part of a clinical intent or event, and handle all those sort of administrative to-dos that are part of that to bring the patient to the starting line or the finish line. So obviously we integrate with electronic health records. That's a common one. So Elation, Dr. Chrono, Athena, Epic Cerner, Advanced MD, a lot of the folks, eventually, Hint Core, all in one, all that. So that obviously is to pull in like the basic patient demographics, and if we can, understand orders and events and trigger workflows based on that. So again, our intent is to build the full holistic sort of process of clinical event or intent occurring in the EHR, or other system, and what is all the to dos for the care team, broadly speaking. And so that also plays into like the productivity space. So form tools, telephony solutions, e-faxing, and sort of this exciting new space is like the payment solutions, and effectively what is where are the triggers that launch stuff for the care team, broadly speaking, to manage. And so what is exciting about this new Hint integration is a lot of times the sort of like top of the funnel, the sort of trigger for a patient entering direct primary care practice is, signing up for your membership or services. And that is the sort of inception event. And so that event in Hint can now trigger a downstream workflow in Doc that, okay, patient Bill Smith has signed up for, my DPC clinic. And that then tells the team, okay, new patient, ding, 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 let's all go to work. And our vision and what we do a lot is to try and automate as much of that
Yeah.
downstream stuff. So it's, send an email, we can trigger that automatically, or, create a record for the patient in Elation or Athena. We can do all that. So it's trying to, take what is otherwise super clunky manual work and automate as much of it as possible.
Yeah. Automate is such a buzzword nowadays, right? I mean, that's like the gold mine. If we can automate things so then us docs can just focus on our patients, that's absolutely beautiful. Yeah, I know. I mean, in my personal clinic, this is, just here, it's like I have my running list of what I want to do every time a new patient signs up. But now, there's another doc that works here, and then the nurse that we just hired. It's like a lot of times I find myself thinking like, well, they should just know what I'm thinking, of course, but they don't. And
Yeah.
so something like this would be fantastic to be able to just say, hey, this is the, we're growing, our team is growing, or for practices that already have a big team, like, hey, this is what we do. It's more standardized. It captures that funnel to where there's not holes. And,
Yeah. I mean, this is just, fundamental stuff that is worth me, mentioning for a minute. Like a lot of what we do is sit down with organizations and just, ask the question, like, what is the preferred picture? Like, what do you want your best practice to be? And
Yeah.
very few people actually have that identified. And so the first step is really, because we make it up as we go each and every time, even if it's pretty much the same every time, like we like just kind of run by the, seat of our pants or fly by the seat of our pants. So, it's really codifying, like, what does our new patient onboarding flow look like? What are the sort of 5 essential things we need to do each and every time? And then, again, how do we trigger that automatically through Hint or other integrations? And then how do we farm out as many of those tasks to automation?
Yeah. That's awesome. I love it. Again, I'm sold. Cool. So, yeah, you've hit a lot of the questions I have so far. I just want to make sure we don't have any questions rolling in before I keep going. I have a couple people saying, very excited about this integration. Yeah, this is really cool. So with Hint, then Hint has the Hint core side, which is the membership management piece that has been around 10, 11, 12 years now. It is adding Doc into that will be fantastic because there's a few automations there for new patients and things like that and tasks. But this is going to really take it. 1 + 1 = 10. And then the all-in-one side is the EMR side and the all the other pieces to run the clinical side of the business. So marrying those 2, 3 together will be pretty cool. I'm excited to see, and I get to see a little bit under the hood just as the medical director of the development behind it and making sure that everything clicks together. It's going to be, not to like lead everyone on, but it's going to be awesome. So
yeah, looking forward to that future state as well. And it's great to, I should just say, it's great to have a partner that like gets it, that we can work together to that shared vision.
I'm getting teary eyed. You should stop. Cool. Yeah. Again, anyone who's listening, if you hopped on late, feel free to send questions over in the comments, and we'll go. They'll pop up on the screen, and we can go through them. Yeah. Maybe there is one here. New member onboarding form from Hint Core to Doc. Let's say, like on my website, I have the Hint onboarding embedded, right? Yeah. Someone signs up, they put in their basic demographic information, and then it sends me an email. Hint sends me an email. Hey, someone signed up. Yeah. And right now, that's kind of the end of it. It's up to me. It's up to the other two, and here in my practice to like do something, right? Yeah. So that is where Doc would come in, right?
Totally.
It would disperse and go forth, right?
Yeah, and we didn't talk about this in prep, but I could show you what it looks like if we have time.
Fire away.
Yeah, I mean, I think just to speak to it to a high level, and then I'll just demo it and hope that it doesn't crash. Yeah. So yeah, fundamentally, there are triggers happening in Hint, right? So patient signs up for services in Hint, that we can map that to, hey, I want this new patient onboarding workflow to launch in Doc. And that can happen in real time. And so
Just the
there may be
scheduling.
other triggers, right? Like,
Yeah.
patient cancels. What does our offboarding process look like? Or
Yeah.
patient, reschedules, whatever the sort of, there's an overdue bill or whatever the case may be. Like, going back to that earlier point, what is your process and structure around a given set of circumstances? What does that ideally look like? And then you can build it out in Doc and then ideally trigger it automatically by events happening in Hint and eventually all
I'm really trying not to hijack this whole conversation and like have you personally fix my practice.
in one.
But
I am
really,
probably not the right person to be doing that, but I will happily share whatever we've learned in
yeah,
deploying in hundreds of practices.
I know, right? You guys are blowing that.
Let me make sure. So I should have figured out how to share screens
That's okay.
before I share like my entire screen here. Let's hope for the best. Okay, you let me know if you can see this. Can you guys see that?
Yep, popping up right now.
Okay, so this is like my Doc dashboard. Maybe just orient folks for like a hot second. This just shows like, well, what do I have to pay attention to today? And this is obviously like a really thin version. I don't have a ton of tasks here, but this is a one-off task, not a Hint triggered task, but you're seeing a patient in clinic. They've got, Crohn's disease and they're complaining of belly pain. They need an urgent GI referral. Again, great task to maybe farm out to, one of your colleagues who can help coordinate that. And so, you can assign it to a particular individual. I'm going to ask, Deb to may help with this. I can set due dates. I can put a status on that task, and you can create any number of custom statuses. We know who the clinician lead from our practice is, and this is all data that we might pull over from Hint or another source. What subscription tier are they on? How long this task has been active, and even like comment in the context of that task. So we've got the patient context. We've got a comment here. He's heading over now. So again, instead of reply all emails and sort of Excel files and post-it notes, this is like a singular sort of administrative and operational hub for the practice. And then when that task is complete, it goes away and everyone, moves on to the next one. From a Hint perspective, so just to walk through this for a moment. So this is maybe a list where we've got a bunch of team members from our clinic, right? Our DPC clinic, and we got the clinical and operational and administrative team on this list. So we're all trying to manage a process together. And this is an example of what we would call a workflow. So we've defined a set of tasks for new patient onboarding. So in this case, there are 9 steps in this process. Here are the 9 steps, and this is the patient for whom we're doing this work. And you can see that this is data that is being pulled over from Hint in this case. So we've got their Hint MRN, we've got their demographics that were put in there, and we can even link to their profile in Hint. So maybe I'll just hit this and show you all what that would look like. So if I want to go into Hermione's profile in Hint, I can see that she's 33, she's unpaid. And this is her demographic info. But what's cool is that we can determine, like, I want to launch this workflow each and every time a new patient signs up for Hint. So if we go back to Hint here, and I'm not a Hint expert, but I'll do my best. So I'm going to create a new patient under the assumption that we're either doing this manually at the practice level, or it's happening, on a website form that someone's filling out. But we can Bill Pestery, and date of birth of 06/01, 1999. He's male, and we'll give him an email of bill at doc.health. And we can put in obviously the rest of their demographics, but just for illustrative purposes. So we just created Bill Testery in Hint. And if we go over here into Doc and we refresh real quickly, we will have, hopefully, a new workflow for Bill Testery with all the right people assigned to those tasks. So all these folks on the admin team that are managing this process all got notified either by email or by push notification here or on their mobile that new patient onboarding workflow is launched in Doc. And now everyone knows who's responsible for what. And ideally, we can manage some of these tasks in an automated fashion. So, verifying the patient is appropriate, that might be something that we're going to have one of the admin staff call and make sure that they're, alive and, they're local and whatever, that might be a task for a human. But
Yeah.
like sending the HIPAA form, maybe that's something that we can automate. And so we can trigger, a marketing template with a form link to go out automatically. We can create a record for the patient in the EHR, like elation, for example. So again, just it's defining the process, it's integrating with the right systems, and then is triggering these flows. And again, now we've got, we have a profile for Bill. We've got a hint link, so we can link back to their profile and we can see that it's synced across with Doc. And if I'm in hint and I want to go, whoops, I zoomed too fast. If I'm in hint and I want to go to that patient's profile in Doc, I can simply launch back here, and now I'm back into that patient's profile with the workflow that we're doing, together here and now.
Nice. We have a question that just came in. This is a good time for it. Our workflow, this is from Kelly. Here it is. Are workflows and tasks defined by the practice and of the provider, or are they stock?
Well, the short answer is yes. So that we give a bunch of templates and things that are out of the box that you can use as inspiration, but they are totally bespoke to the organization. You design them, you build them, and just to flash that real quickly, this is our workflow library where people design your processes. This is the template, and you could go and create a new one. So this is the gold standard. Like takes you all of 5 minutes to create your template. And the magic would happen when you go and say, okay, when this thing happens in hint, trigger this workflow to launch in this list, and that's all done pretty quickly.
Nice.
This is an example of what we call workflow. This thing is more of an example of what we call smart flow, which is more of a process. So just to
we're still in Bill Testeries. I don't know if we.
Oh, am I?
Screen.
Oh, sorry. Weird.
Okay. I didn't.
I wasn't sharing a tab. That's interesting. Can you guys see this now?
Yep. There you go.
Oh, weird. I must have been like mis-sharing this whole time. So apologies if you were
no,
not seeing everything. So this is basically what we call a smart flow, where you can create tasks that are linked to the appropriate next step, and then if this, then that. So in this case, we're calling a patient to check in on them. That's assigned to me, the doctor, and depending upon how they're doing, that will determine the next step. So it's creating a follow-up, or me launching into an entirely separate workflow because of they're not doing well. So again, it's really, to the earlier question, it's all about what is the preferred picture and what is your process and how do we design it based on the needs of your organization.
There's the old adage of, I don't know if it's old because direct primary care is not exactly old, but once you've seen one DPC, you've seen one DPC. So this is like you said, just such a good vocabulary word that you can just build it exactly how Strive Direct Health, my clinic, or whatever clinic it is, they can build it exactly what they want. Chris, he asked a question: how will it look on the Hint all-in-one? This is still it's all in the core Hint core side right now, the business side, and over the next few months and quarters, it'll be incorporated into the all-in-one side. So kind of a punt right now, Chris. I apologize. But there's, as you know, there's a lot of moving pieces with the all-in-one that this is gonna be folded into quite nicely. My guess is it'll probably replace tasks and reminders, which will be nice. So, but now that I said that, all the Hint team is probably gonna come after me, but it's okay. No, that'll be over. In 2024, that'll all get folded in. It'll be absolutely beautiful, as it is already on Dock. So, good question. Good question so far. Any other thoughts before we move on, Dr. Mike?
No, thank you. Be careful what you ask for.
I know, right? I love hearing myself talk, so I could talk all day. Even if no one's watching, I could just talk to myself in the camera. One of the things I saw a stat, and this is, I don't know, I couldn't fact check this, so I tried, but there's actually, someone was making the argument that there's not a doctor shortage, not a primary care shortage in the country. There's actually just an inefficiency problem, right? And so this is solving that, right? I mean, it is, if we can eliminate the administrative workflow, then either A, we could see more patients, or B, there could be more, less burnout. I mean, there's a whole, thought process behind that. So this is kind of where my mind is going right now. Like, hey, this is eliminating a lot of major pain points for practices and for individuals as a whole. So I appreciate it. Thank you. So as we keep going on, what other, I want to just call out to the audience again, what other pain points do you have in your own practice that maybe we could try to fit, or anything like that, or anything that, any other questions that you have, feel free to type them in. We're not going to sit here in silence until you do. We can keep talking, but just as you think of them, send them in the comments. It makes it a lot more fun. Cool. So, what is, how do I ask this question?
You don't have to wordsmith it, just fire away.
I know, right? Yeah, I mean, you've hit all of the main things that I want to talk about anyway. So, all right, let's jump here. What, let's say we've never met before, right? And I'm like, oh, I heard about Doc Health. How do I get started? Like, what's the easiest way?
Yeah, thank you. So, basically we have folks go to our website and set up a demo. It's a 30-minute demo. The intent there is not to force you to like sit with us and all that, but for us to really learn about your practice and again, learn about your workflows and your systems and your tools. And so, especially after attending the HINT conference, or summit, excuse me, was, we were talking to a lot of people that were on, HINT and Elation and Spruce and, Google Workspaces and, hopefully more and more, all-in-one type folks. But it's, it's a quick demo for us to understand your processes, where your pain points are like, and I would love, maybe while you may already asked that question, but like, what are the pain points that folks are hearing, on the call here, or feeling, I should say. But it's a quick demo. We typically record them and share the recording so people can share it with their organization, and it makes it easier to sell internally. And then we offer a 15-day free trial so people can go in, poke around. Again, it's meant to be, we're inspired by like the consumer tech world. And so we are trying to make this really elegant and simple and user-friendly and not, typical healthcare as I think you guys are. And so it's meant to, for people to be able to create their own workflows and smart flows and, invite their team and really fundamentally, just use the platform on its own before going down the road of like integrations and automations. So free trial, hopefully they subscribe, and then we can, head into the world of what we call professional services where, folks, we can set them up with the integrations to HINT, the automations that come downstream of that. But it's, it's meant to be a pretty slick process.
Nice. So Angie Cortizo has some good questions right now. Will Doc give us a better way to manage multiple practices in the future? She currently manages a group of DPC practices. Is it a doc for each one? Is it a doc like a mother doc, and then there's all the little doclings, if you will?
Yeah, that's a great question. So Doc, as Angie is pointing out, is it's meant to get a single organization organized, so to speak. But we do offer now, and we'll increasingly move in this direction of like multi-org. So you can create multiple organizations that live under that sort of like parent organization. Mm-hmm. And what we're working toward more and more, some of this is real near term, is being able to surface all relevant stuff from across the organizations in one singular view. So, as we move up market into more like, hospitals and health systems and more sort of complex organizations that have multiple departments, divisions, or, in like value-based care organizations or MSOs and these more complex organizations that are multiple practices all in one, like that's certainly where we're heading. So long-winded way of telling Angie that, we're heading in that direction, that we do have some of this capability now. And if folks are interested, happy to get into the weeds during a demo or in follow-up, but definitely the direction we're heading more and more.
That's really cool. I think I saw just briefly when you were sharing your screen, it's almost like you can send tasks to a pool, right? So maybe that's one way. I'm just thinking of, in the short term, if someone's using it, they have 6 practices, like, oh, I could just send it to the pool, and anyone in that practice could just, hop on and call that patient. It doesn't have to be someone at that.
Yeah. So we have the concept of like groups, right? So you can create, whatever, a nursing pool, an admin pool, a scheduling pool, whatever.
Yeah.
that generally operates within an organization. We are, as I'm sure most healthcare organizations are, super mindful of like the data silos, and we try and break down as many silos as possible, but also need to erect them from a sort of security compliance perspective on making sure patient populations aren't mixed among clinics, and people have the right access to stuff. So um, what's cool about sort of where we're headed, and frankly where we are to some degree, is being able to basically move organizations and have an aggregate view, so that that homepage I showed you, we could pull in the relevant tasks that are due for me today or that are overdue from across the five. If I'm a hospitalist here and a DPC guy there and a GI doctor on the side, like I could pull those tasks that are relevant for me across those three domains, but go into them, drill in where appropriate.
Yeah. And you mentioned, sorry, I'm just asking all the questions now. So anyone else, please comment as well. And did I hear you said you have an app as well, like a mobile app?
We do have a mobile app. It is it's pretty simple in the sense that you can
Simple as
complete a task, you can comment on a task. It doesn't have all the sort of workflows and automations and things. That is an area of focus in the coming months for us. But short story, just this is like perhaps filling the space, but we started really as a mobile first solution, thinking that everyone was like me, because I'm a mobile guy. And I think we quickly learned that really our power users, and this probably is relevant for the folks listening, like our super users of the platform are really the administrative and operational minded people of the organization. The clinicians are still in the HR doing their good work there, and they're driving work into Doc, through orders or events or intents or things that are happening in other systems. So, the last thing I wanted was another thing to do. I'm sure that's the general sentiment of most clinicians. So, what we provide for clinicians is the ability to see stuff, to delegate stuff, to have visibility and accountability for the team, but not necessarily be a place where you're going to be checking boxes. It's really meant to give the care team, broadly speaking, a singular place to manage it all.
Nice. Oh, that's fantastic. I love it. I don't know. We're right at half an hour. What else do you want to? Anything else you want to discuss?
I'm just looking at this last message from Chris. Maybe I'll do my best to answer this. So
Sure.
I love automation, but I feel like patients followed me to DPC for the personal attention they get. So I think like this is what it's all about, Chris. I'm glad you asked this question. Like for me, it's allowing Dr. Brad and I to like and you present to like be with the patient and not worry about the hold on, let me like call the front desk and ask them to do this thing, and hold on, let me send this email before I forget. And worst of all, like, hey, call me in like a week and make sure like we put in that referral that I told you I was going to do for you. So to me, it's all about automating this work. This isn't patient facing stuff typically. It's really more operational, organizational stuff. So the hope is that the clinicians focus on the patients, and everyone has their marching orders and knows what to do, as opposed to like making it up on the fly or hoping that we remember to do it after the visit.
Yeah. Or assuming that your staff knows what you're thinking, right? Like my. No, that's good. That's a great question. Thank you, Chris. Cool. So again, anyone for those listening, looks like doc.health/calendar is to hop on for a demo, where you can go explore on their website, doc.health. It's fantastic. I did a deep dive on your website just for fun the other day. I like to try to poke holes in things, and I couldn't. Thank you for that.
Awesome.
Yeah. I'm a doctor, not a tech guy, so maybe it wasn't that deep of a dive. But we have another live stream on November 8th on ways to market your DPC. That'll be a popular one because everyone wants to know how to broaden the funnel, like you were saying, Dr. Mike, and reach more people. There's a great marketing team at Hint that they're putting together a great talk there. So tune into that on November 8th. Should be at the same time. And other than that, this is great. Thank you again, Dr. Michael Doctor.
Thank you.
I had to say it. Sorry. And we'll see everybody next time.
Appreciate it. Take care.